record this for our YouTube channel as well. So without further ado, I am going to let Leah introduce herself.
Good evening, everybody. Thanks so much for having me. In case you haven't read this or been apprised of it, I'm Leah Bomesberger. I am a nurse by trade, but I also have my master's in public health. Currently, I'm working as a bedside nurse in the ICU here at Monument in Rapid City. I was working as an infection preventionist under the epidemiology group with the South Dakota Department of Health, but I was doged last year. I was cut with all of the CDC and the public health funds that were cut by the Trump administration. And so I would still hopefully be with the state, but unfortunately there was about 4 or 5 grants that they cut and so unfortunately I'm not no longer with them. I am, however, still looking for work within this area of expertise. I was able to work for about 5 years with them, specifically with the public health, infection control and epidemiology. So dove into it pretty deeply. I like traveling and eating street food, which you're going to find is a little bit of an anomaly with some of the the stuff that I'm talking about with infection control. Um, and then I love swimming and all sorts of stuff like that. So happy to be here. Thank you so much for having me.
Thank you, Leah. And Leah is a mom of young children as well. So not only does she have the expertise from her practice and her education, but then she's lived experience too.
Always helpful.
All right, and then our in-house ECC expert is Krista, which most of you guys should be aware of, but we're going to turn it over to her and let her introduce herself as well.
Hello, everyone. I'm Krista Caldwell. I'm the school age specialist here at Early Childhood Connections, and I am excited to be here to talk about kind of the health and safety and wellness. That's kind of my background is a lot of, in wellness management and things like that. Um, yeah, other than what I put up here, I like to travel. I like to hang out with my family. We just went snowmobiling this last weekend, and sadly, there's not enough snow in the hills, so we're trying to look for it elsewhere. But yeah, I'm very passionate working with school age kids in particular, but I love working and helping the adults that also work with those children. So I'm just happy to be here and hope you guys get to take something away tonight.
Excellent. Thanks, Krista. And I didn't introduce myself, so my name is Rose. I am your facilitator for all of these Evening with the Experts. I'm here to help guide and go through the process. If at any time you guys have questions or thoughts that you'd like to chime in, feel free to hop off of mute or drop it in the chat, and I can find a time to bring it up to one of the experts as well. Okay, so tonight's topic, I'm sure a lot of you thought, I know this is like childcare 101, right? Like we know about how to clean, how to wash our hands. But sometimes when, especially if we've been in the field for a while, we can become complacent, right? It can just become things that we've forgotten about. So I'm hopeful tonight that either you're going to learn something new, you're going to have that refresher, and you're going to also walk away with maybe a deeper understanding of your why that you should be doing this. It's not just the checklists and the policies. What is the overarching reason why we should stress the importance of health and safety practices in early childhood? They're not extras. They are the conditions for equity for these children. We are providing them with this safe, healthy place to grow and thrive. So you guys are helping to protect young children's bodies, support their well-being, and then respond to their need to seek for the risks and changes and how you help them navigate that with appropriate boundaries too. So when systems center health and safety, families and communities grow stronger. You guys are a part of a larger community, city, state, nation, and you are doing that hard work within your center, your facility, your in-home daycare by providing these children with the best health and safety practices you can. So I appreciate you guys all hopping on tonight, and let's tuck in and we're gonna listen to the experts. You can see my kid president quote here. If you make the world better for kids, you make it better for everyone. Kid President is amazing. If you guys are unfamiliar with him, look him up on YouTube. He is just a joy to watch. So here are areas of importance for health and safety in early childhood. There are 8 different areas that the experts are going to speak to, and tonight we are going to start off with Leah.
All right, hand washing and personal hygiene. I think since COVID, everybody's like, yes, we get it, hand sanitizer, hand washing. But I can tell you from experience, even in the hospitals, we still have to audit and we still have to remind even physicians to do this on a very regular basis. So, next slide, please. So from the 30,000 foot view, we're going to kind of look at it from high above, but then we're going to get dive deeper and deeper to some pretty nitty gritty details, which you'd be surprised at how far into the weeds you can get with infection control and hand hygiene. If COVID taught us anything, it's that it can sometimes become very complicated. But in general, I want this 30,000 foot view to be if you are working in a childcare center or a school, you really need to have some of the most basics in order to reduce the spread of infectious disease. You need to have formal written policies that will reduce infectious disease not only to those kids, but to your staff as well, including what is your vaccination policy, formal education of your staff members. I think there's a lot of really young teachers out there that we assume that they know things, but they actually might not know the details, especially things like how to read a disinfectant label, things like that, which I'll get into. Obviously, good hand hygiene by everybody in there, appropriate cleaning, and then food preparation, toileting, etc. You guys are the front lines of teaching our kids how to be civilized human beings, how to eat and go to the bathroom and everything. So all that is really important. Next slide, please. So in the early 2000s, I had the privilege of working with a physician in Nepal. I traveled to Nepal and worked with her in a leprosy clinic. And one of the things they had obviously way fewer uh, resources than we do even here. But one of the things that she taught me there was if you teach kids, they will take that information and take it home to the parents or their caregivers, and therefore you can a lot of times diagnose or identify people that we would have missed completely within the clinic just by teaching the children. So you guys are more than just the front lines. You're teaching that future generation to potentially go home and be good models of these behaviors, as well as potentially catch some life-threatening things, truthfully. So hand washing, like I said, we can just go round and round on this and talk about it forever. But essentially, the biggest thing is you need to model good behavior with it. So you need to be consistent about doing it. You need to have the things readily available for you and your kids to do it, and you need to do it appropriately. Gamify hand washing. I'm not going to tell you guys what's out there because you're the experts in finding age appropriate hand washing skills. I will say though, if you, and I know Rose had mentioned this earlier, but Germ Glow is an incredible product that is, it's invisible, but you can kind of sprinkle it. You can put it like in a cup of, chips or something like that, and then have everybody touch it. And then you take out a black light and then you can show to see how a very simple thing has spread exponentially by just, having a teaspoon of this in one section. Rose, you can kind of jump in there too. I think you said something you had that available, right?
Yep, so we have that kit here. So if that's something that you would like us to come in and do a lesson with your kids in your class, we absolutely can. Or if you're an admin, you own your own center, we would be happy to come in and do a deeper dive into some safety and health practices and use this on your teachers. I will say we've had great luck and a lot of interest when they see, I thought I was washing my hands really well, but actually look at what's still on my hands. So yeah.
Exactly. And we use it in the adult world all the time too, even in healthcare. So this spans many generations. So with that being said, if you at your facility, I really encourage you to just take a look at your physical stations. Do you actually have access to hand hygiene stations? Are there hand sanitizer at appropriate levels and available in very critical places near the bathrooms, near the front door, near tables and things like that? One of the things that I really dislike seeing is when I walk into a bathroom in a restaurant and it's disgusting and you feel almost dirtier washing your hands there. So keeping it clean and ensure that there's a process or a policy and ensuring that those sinks and everything like that are cleaned on a regular basis. Hand sanitizer, there is a lot of stuff on the market. Amazon has access to a lot of dupe type stuff that's not been vetted. And so I would really make sure that you look at your hand sanitizer, make sure it's at least 60% alcohol. content in order to effectively kill those germs. And then avoid any fancy or fragrance sanitizer that has like colorings or beads or anything like that. You're putting this on your skin, you're around small children. Those typically aren't going to be at a standardized level like some of the other products out there. So I encourage you to take a look at what products you're actually using in your facility and kind of vet them a little bit better. So next slide, please. Hand washing, basically, if you're asking the question, should I wash my hand? Then yes, you should be. When they come into school, kind of build this into your schedule. Like, hey, this is what I do with my kids. As soon as we get home from school, we go to the bathroom and wash our hands just automatically. When they arrive to school, same thing. You don't know what they're doing in their house or where they touched right before coming in. So it's just one chain of infection piece that you can kind of nip in the bud. Obviously, before eating, obviously, after toileting, after outdoor play or any kind of messy play, encourage you to use hand washing stations instead of the hand sanitizer at those points. Because again, even in the hospital, we say you can use it about hand sanitizer about 7 to 10 times before you start getting kind of that icky buildup, and then you really need to physically wash it off and kind of start fresh. Plus, you want to get the debris off your hands instead of just sanitizing. So, next slide, please. I do want to consider this obviously as part of your personal hygiene in general, but respiratory hygiene and cough etiquette is so, so important. If you look at the spray that happens when a child sneezes, I mean, it's disgusting. You guys know this. I have 3-year-old twins right now, and it is wild to me when you can like see that spray. So always making sure that you have enough Kleenexes or tissues around your room and encouraging people, cover your cough. Use the bat wing method into your shirt or making sure you have the Kleenexes. Dispose of that tissue afterwards. Always wash your hands afterwards. And I really encourage people to wear a mask if you're coughing and sneezing, obviously. Making sure that your staff feel empowered to do this if they themselves feel sick. I will often wear masks in the hospital, even though I'm fine, but knowing that I'm around a lot of sick people when it's respiratory season, just to kind of protect myself. So we saw during COVID, masks do work, and you should be able to use them if you want to help kind of limit that spread of disease, obviously. So next slide, please. So bathroom diapering and bodily fluid procedures. So much fun. If there's any key takeaway, and I'll say this at the end too, but if there's any body fluids, just assume it's infectious. Okay. So next slide. You're going to want to obviously have gloves on hand. Make sure they're properly fitting too for your staff members. This is super important. People are going to find workarounds, and if gloves don't fit well, they're not going to use them. So, proper disposal of waste. If you're diapering somebody, or if you have children in your care that have diapers, make sure that waste basket is away from any of your food preparation area or whatever. I mean, this is just common sense, but we be surprised at how little common sense there sometimes can be when you're looking at like your flow of work and things like that. So making sure that those toileting things are really away from your food, and any other kind of like clean procedures essentially. Same thing with like if you had bloody noses or somebody had a cut, that kind of those consider it biohazard. Keep that in a trash that's in the bathroom that can be closed, or it's not going to be spilling over and potentially contaminating other surfaces in your work area. Sanitizing the surfaces, having the proper disinfectant to use on a regular basis, which we'll talk about a little bit more in detail here. And then obviously hand washing after every single change. A CDC did a study that said that we touch our face on average about 23 times an hour. And I would say that's probably a little bit more, to be honest. That's a lot of times that we're touching our face or we're touching other things. I know for me as a nurse, you need to wash your hands immediately. It's easy to say like, well, I'll just diaper this kid and then diaper another kid. They're both dirty, that type of thing. Well, how many other things are you touching between kid A and kid B that you're potentially contaminating that you're not actually going to disinfect later? So making sure, I just start building it in your workflow. Diaper a kid, hand sanitizer, put on a new pair of gloves, that type of thing, just because you never know when you're going to get pulled to that kid on the that's trying to, choke on something or whatever, and you haven't had a chance to properly clean your hands. So just build it in immediately. Next slide, please. I kind of put this in here as a joke because I'm like, diaper change or is it Ebola or COVID? My husband and I both worked through the 2014 Ebola scare. We did actually work through a couple potential cases, unfortunately. And then COVID, obviously, that's me on the right hand of your screen. That was actually before, that was one of the worst weekends of my life, to be totally honest. It was height of COVID, and I think I had a patient die every shift. So, proper PPE, or personal protective equipment, is so, so important. The picture of me in the middle there is a mask that we reused up to 5 different times. When we were in the peak of COVID. And I think it's just important to know that, like, the PPE that you have, the gloves, I know it seems really mundane and it's really easy to think these are healthy kids for the most part and stuff like that, but there's a potential that there's going to be infection that could, go down the line. And so you want to make sure that you're protecting your staff members and or yourself, truly. You're going home to family and loved ones, and that's what's really important about this. So that's what we're there for. Next slide, please. So what about cleaning, sanitizing, and disinfecting? Boy, we could get into this pretty deep. We'll just start kind of with the basics though. Next slide. There is a major difference between just cleaning and disinfecting something. So, cleaning something is just going to physically wash that dirt and germs down the drain. It's going to take it with the soap and the water. The soap can obviously have a sanitizing or sometimes a disinfecting effect, depending on the product that you're actually using. Disinfection and sterilization, though, is actually it utilizes chemicals or actual devices to kill germs. So, if you can imagine, obviously, if you've gone in for any kind of a surgery, you're going to hope that the physician has had fully sterilized equipment there on the far right, so you don't have any potential pathogens that are getting in. Um, uh, during your procedure. I do like to say that there is a really great product. So I know we talked about Germ Glow for kind of looking at germs in general. During my thesis, I looked at cleaning and disinfection of dialysis stations. And dialysis, if you know of any loved one or know of anybody that has had to go through dialysis, there's a lot of blood. They're essentially cleaning your blood. They're acting like your kidneys, right? And so the nurses are under a very like short time constraint where they have to clean the dialysis stations in between each patient. And they have to clean, not only clean, where they physically wash or like take away the blood with the cleaning portion of their process. They also have to disinfect it. There's something called luminol, and if those of you that have slightly older kids, this is a phenomenal, fun activity to do. Luminol is used in crime scene forensics, and it's actually an agent that reacts when it comes in contact with hemoglobin in blood. And so somebody can actually like clean surfaces. They can even potentially use bleach like in bathtubs or things like that, and it'll look clean. So as you can see in the picture on the left-hand side there, during just broad daylight, you can't see any blood, right? There's no blood there. But there is microscopic levels of blood that's in that carpet. And when you spray this luminol product, it basically creates this bioluminescence, and it glows under black light. And so when you turn the lights off and you put black light on it, you can actually see hemoglobin or basically microscopic blood. And so you can buy luminol, these luminol products, and then you don't have to use real blood. You can buy a fake blood type product, and then you can kind of make these like type crime scenes where it like looks physically clean, but you can see the invisible blood beneath. This was super profound using it with the nurses, because I actually I snuck in at like 3 a.m. in the morning, and I did luminol on all their dialysis machines to show them that there was some areas that were not fully disinfected. Super great visual. So I think we were talking to like as providers, we always kind of like get the ick with head lice or bed bugs or things like that. Nurses are the same way. Man, we are so good with our PPE and washing our hands and being like, super clean when we have a patient with lice or bed bugs. But it's like when somebody has a multi-drug resistant organism that we can't see, we're just like super, like laissez-faire about it. And we shouldn't be really, because those are the ones that are kind of the worst. So next slide, please. So when you are disinfecting something or when you're cleaning something, you want to make sure that you have a schedule in place for this. So you want to frequently, and the things that you really need to focus on are those high touch surface areas. Those ones are going to be your light switches, your doorknobs, tables. This is a great example, your cell phones. When was the last time you disinfected your cell phone? And when was the last time you took your phone into the bathroom? I am totally 100%, I'm guilty of this as well too. But I think there's some studies that have been done that have said that, there is like your cell phone is essentially far dirtier than any toilet seat, because of just how much we touch it, how much it's around with us, and we just never clean it. So in your daycare facility or in your school, I really encourage people to routinely throw away toys that are broken, that have cracks on them or tape on them. Tape is just like the sticky little rug that germs can just adhere to, and you really can't get those super clean, especially with small children. So go through, get rid of stuff, replace things as needed. Water toys are a really big one. In the warm months, they need to be sealed shut, and you need to be able to thoroughly drive those to prevent mold growth. The pictures above are of basically they had taken cell phones and imprinted it on a petri dish and let those organisms grow, and you can kind of see those are like probably 17,000 different organisms that they've been able, to kind of identify. Most of it is like pretty benign. Obviously, it's not going to make us sick, but there's always that chance that one of those can make us sick. In general, you want to increase your cleaning efforts during illnesses or outbreaks. So if you have the kids starting to have diarrhea, I would say get that disinfectant out and start doing it kind of on a more frequent basis. Next slide, please.
Two things to add there for Leah is when she said to seal your water toys, I just taught this to a provider. Take your hot glue gun and glue over the hole when they're brand new, and then they still float, but they're not going to soak up that water. And then just periodically check that the hot glue plug is still there, so you're not, it hasn't fallen out, it hasn't become a new mold trap. So yeah, just wanted to add how you could accomplish that.
Yes, absolutely. Thank you so much for that. That's great. Okay, so how do you read a disinfectant label? A couple different things. I really encourage all of you guys when you get back into your classroom tomorrow, look to see what actual product you're using. Do you even know what it is, what it's called? And then you need to read that entire label and figure out how to use it. So there should be very specific information on there if it's a good product. First thing is going to look for an EPA registered product. I think Rose sent out a list of some of the resources that I have, but I do have the EPA where you can go in, or you can just Google it, honestly, but just go in and look to see if it's registered under the EPA. If it is, then you know that COVID had so many interesting life lessons, but one of them really was the fact that even the PPE, there was like dupe PPE. There was things that were that hadn't gone through the right rigorous, training and things like that, or rigorous steps in order to be safe. So things that you want to look for are, how dangerous is this chemical, first of all? How do I use this? Do I need to dilute it? If I do, how much? What surfaces can I use it on? Some things are not allowed to be used on, like wood, for example, or electronics. A lot of times, like if you see in the hospital, you'll see actually some of our surfaces have been cleaned so many times that it's like breaking down the plastics of of like our counters and stuff like that. Some of that is just going to happen, regardless, but others is like, making sure that you're using the proper chemical on it. Make sure you have proper storage and disposal. If you keep these in like a high heat or sunlight area, heat and sunlight can oftentimes break down chemicals and create an entirely different chemical. So you're not even using it. It's not even like effective anymore. Expiration date is a huge one. And then another one is the contact time. So they have these like kill times that disinfectants will put on there, and oftentimes it'll say, it needs to have a contact time of 1 minute for it to have a 99% efficacy, essentially, or for it to actually kill what it claims to kill. That means that surface needs to be visibly wet for a minute or more. So maybe take a look at your disinfectants to be like, does it have to be wet for 5 minutes? And are my things actually wet for 5 minutes? Because if they're not, then we're not actually disinfecting properly. So you need to know how that works. The other really big thing, because you guys are working with children, is it safe or approved for food or contact surfaces? Things like that. So really encourage you to this is a CDC Project First Line that kind of has, I like this infographic because it's really good and it breaks it down for you. But if you're an administrator or something like that, go and look at what your products are and see what you're using and see if they're actually doing what you need them to do for your kids. Next slide, please. I do kind of want to point out too that all chemicals are not the same. So remember I talked about like what do the precautions say on it? Does it say caution? Does it say warning? Does it say danger? Those are all three very different words. Caution is going to be obviously the least concern that you're going to be versus like a danger. So you want to be storing these in appropriate places and making sure that kids are not going to be accessing them. A, B, could you be using a different product that's going to be safer? Just as a reminder in general, a child exposed to the same dose as an adult has a much larger exposure than the adult because of their size and just how incredibly vulnerable they are. So make sure that you're reading that label. More isn't always better. If you're, I think it's like a teaspoon of bleach to a gallon of water if you're doing like a disinfectant. That's not very much. If you're using more than that, there's a lot of noxious fumes that you're not only exposing yourself to, but those kids as well. So with that in mind, when you write your cleaning policies or when you're doing your cleaning and disinfecting, are you doing it under proper ventilation, having the right personal protective equipment for yourself so that it's not, and or, kids if they're around you. But really, it's important to keep kids away, especially those with any asthma or respiratory issues. I do also want to point out as well, there's been a lot of research studies on microfiber cloths. They're really phenomenal. They are very effective with cleaning in grabbing different germs and things like that. Like they collect a lot of them because of those microfibers. They're cost effective because you don't have to throw them away, like paper towels and different like single use items, and you can just launder them. So if that would be like I think a really good investment for facilities if you're looking at something. Next slide, please.
Provided they don't have sensory issues in touching the
Yeah,
microfiber.
sure, yeah. Well, you could always be wearing gloves. You should be wearing gloves. So, okay. So we in public health say this all the time. And I know you guys probably do too, because there's so many funding issues. But steal, steal, steal. Do not reinvent the wheel. There's a lot of great resources that I tried to send Rose for you guys to be able to access. A couple is if you are looking at actually developing a policy or education for your staff, this green cleaning, sanitizing, and disinfecting toolkit is a great one to start with. I think the nerd out on the details of your disinfectant is that EPA site. There's tons of step-by-step hand washing and disinfecting things like that between CDC, DOH, etc. And then I have that gross but fun read. That's that BuzzFeed article that talks about how dirty your phones are. So just a quick little reminder there. Next slide, please.
And ECC has tons of hand washing posters that are completely free. So if you guys are in need of new ones, don't have any in your bathrooms, whether it's children or staff, please reach out and we would be happy to give you guys some of those posters.
All right, so moving on to food handling and meal safety because kids have to eat during the day, and you guys are not only the environmental services cleaning things and diapering them and everything, but you're also dietarian and making sure that they have safe meals. So next slide, please. So basics here, make sure gloves or utensils are used when you're serving the food and that the surfaces are sanitized before and after your meals. Making sure that children don't share food cups or utensils, and we'll talk a little bit about why, but food is stored at very safe temperatures. So kind of brief overview, seems like common sense, but always good to just kind of have that reminder, that checklist. Next slide, please. All right, what are the most common foodborne illnesses? These bacteria and viruses look gorgeous, like this. They could be a pattern on a shirt or something, but these can wreak havoc if you've had any of these, you know. So salmonella is this one is pretty common. It's linked to a lot of like chicken, pork, fruits and veggies, but interestingly enough, flour is a really common culprit of this, and even dried cereals. Listeria is linked to a lot of ready-to-eat products, but a lot of deli meats and cheeses, even salad. Listeria can have outbreaks in. E. coli, there's a ton of different versions of E. coli. We all have E. coli in our gut right now. But there's an E. coli that produces a Shiga toxin, which causes extreme vomiting and diarrhea. And so while E. coli is mostly harmless, this one it causes extreme vomiting and diarrhea. And this one can be found in leafy greens. They have linked a lot of like cattle feedlots where there's massive amounts of cattle sewage essentially that is gets kind of leaked down to some of those lettuce farms that are next to it. So sometimes the water, there's like this massive contamination that happens and you get massive outbreaks with lettuce. And then there's viruses as well. So norovirus and hepatitis A are your most common foodborne illness viruses, and norovirus is the number one cause of foodborne illness. I'll talk about this because you would likely have seen it and or had it. And then hepatitis A, which is can cause liver disease. And this illness, what's really hard about hepatitis A is that the illness itself can take 15 to 50 days for it to show up in somebody. So they could be potentially contaminating or spreading this disease to many people if they're a food handler and they're carrying this virus and they're not washing their hands effectively. So if you want to kind of be scared, not that you should, but Poisoned on Netflix is a documentary about like overall food safety and some of the history of why we heat foods and things like that, and what kind of what went into why do we need to heat food to 165 degrees, et cetera, things like that. So if you're into documentaries and want to be grossed out a little bit. Next slide, please. All right, so norovirus. This one is the most common cause of illness from contaminated food and water, and it also spreads via the fecal oral route. So somebody who has vomiting or diarrhea, typically diarrhea, they have infected hands. This is why the germ glow education is so important, because then they touch food or handle food that is then given to other people. They consume it, and then the norovirus gets into them and then replicates and then starts the vicious cycle over and over again until people, like a lot of people, are effective. So spreads super easily. I put this up here because this is kind of a seasonal thing. It goes a little bit with like the cold and flu viruses, but we will see, we are about heading into the peak here in February and March of where we typically see norovirus. It's going to rear its ugly head. You can prevent that chain of infection by happening by just having really good disinfection practices and washing your hands. I always say infection prevention is so difficult to like prove to people that it works because they never got the illness, right? So that's why, it's just important to kind of keep an eye out on things in your facility. Symptoms will usually start within 1 or 2 days of eating that contaminated food, but they can also begin as few as 12 hours. Obviously, the vomiting and diarrhea, crampy stomach, headaches, fever, and muscle aches can also occur. We typically see schools and daycares have this, and then our elderly population will also get it. So a lot of long-term care facilities will have massive norovirus outbreaks, and dehydration is one of the biggest risks, obviously, with this. So next slide, please. So prevention, obviously, good hand washing and glove use, but remember that gloves don't replace hand washing. A dirty glove is still a dirty glove, so make sure you're taking gloves off, hand hygiene in between, that type of thing. Always clean and disinfect your surfaces as per your disinfectant label. And then foods really do need to be cooked to a safe internal temperature. So generally, we say about 165 degrees. That would essentially kill off any of the E. coli or any kind of bacteria that might have been lingering or hiding off in there. So keep hot foods hot, cold foods cold when you reheat them, or if they're sitting out, making sure that they're, the food is at 140 degrees when it's sitting there, and then getting rid of it because that just becomes like this warm little petri dish for that bacteria to replicate. Um, the rectal thermometers from the from the oral ones, we don't use those all the time. Thankfully, they don't look at all like the oral thermometers, but just to show you again that the oral fecal route is more common than you would recognize in foodborne illnesses. Next slide, please. I really like this food safety self-inspection checklist for daycare facilities. Just making sure that you've got everything that you need, and again, not reinventing the wheel. There's stuff already out there. You don't need to make your own. And then also, does your food facility have thermometers? Are you checking food temperatures on a frequent basis? Are your fridges cold enough? Are they working? Do you have them cleaned out and being effective? Just so making sure that your equipment is working just as well. So, in addition, and I'll kind of talk to this a little bit more but the South Dakota Department of Health does have a foodborne and enteric epidemiologist. Her sole job is to track outbreaks within South Dakota and make sure that people have the resources and that we're not missing something if there's like a really big weird bug that comes out. And I also like to say, be aware of food outbreaks and recalls. I mean, our food touches so many different things. I mean, the amount of formula outbreaks with like listeria and salmonella and stuff like that is kind of mind-boggling. So try not to be, like be aware of things that might be happening within the community and making sure that those things are not on your shelf. So next slide, please. All right, so illness exclusion and health monitoring, because in addition to everything else, you guys are also nurses as child care faculty. So we'll kind of get into some of the details of this, but next slide, please. Overall, you need to have very clear guidelines for what happens when kids are sick. If they get sick at school, their parents send them with Tylenol and the Tylenol wore off, that type of thing. So, when is it concerning? But the biggest thing, when can children return? Of course, parents are going to be like really uh, um, asking a lot about that. So, next slide, please. The hardest thing I think is that so many illnesses, they just present with the same thing. Fever, fatigue, muscle aches, diarrhea, loss of appetite. I mean, kids are barometers. Like they're fine until they're not. And they're kind of going to have that overall look of like, when should I be concerned? Well, the good thing to know is that overall, the South Dakota Department of Health does have recommendations for temporary exclusion from the child care setting that they should be sent home with so that we don't continue to perpetuate infectious diseases. But essentially, what I like to say, fever is 101, right? 101 is considered a fever. And you should be concerned about that. Their immune system is working on something, and it is because it could be any host of any of these things. We need to take it seriously, call the parents. And I want to know as a parent if my kid is having that. The other thing too, I was an ICU nurse in at Children's Hospital in Denver in the pediatric ICU. And I will tell you this, kids will compensate and compensate until they don't. I mean, their little hearts are so strong until they can't. And so respiratory is a really common cause of declining, overall health. And if you're feeling weird, if you're feeling like your gut is like, this kid isn't doing well, you need to make sure you tell the parents and recommend that they go in to their provider. Know what's happening in your community. I say that because we are seeing a huge decline in vaccinations. And so we're seeing an increase in vaccine preventable diseases, and they very well could be in your classroom. What does that look like? You guys might be the one diagnosing that, unfortunately. So if you're struggling with this, put it on the Department of Health, put it on rules and regulations. They are the ones that have these guidelines for a reason. This is for everybody's health and safety, including your own. We don't have that many PTO days. Like, we need to make sure that we're keeping ourselves healthy, even though I'm sure you guys have very strong immune systems. So, have this laminated and, hanging. This is our girls go to daycare, and they have this hanging at the daycare so that we're reminded, don't bring your kid in if this is what they have. So, and this is how long they need to be out of childcare. Typically, it's after like 24 hours after either their fever has subsided or they're generally like feeling better. So, that's kind of your biggest takeaway from like temporary exclusion when to come back. Slide. I wanted to point this out because use the South Dakota Department of Health. I think a lot of us assume that the Department of Health is kind of regulatory and they're just going to come in to like ding us on things and make sure that, and not get our license, that type of thing. But they're not. There's so many different things. When I was there, I was a consultant for, like outbreaks and infectious disease for healthcare facilities. And so people could call me and be like, "Oh, we have this. What testing do we need to do? And what PPE do we need?" That type of thing. If you have a kid that you're worried about or something like that, and you're just not sure how to make sense of it, call the Department of Health. They will likely get you in touch with the person that you need to, and they are there for a resource. That, and they did updo their website about a year and a half ago, and so it's a lot more user friendly. So, next slide, please.
And
With
I'll
that being, oh,
Oh, I
sorry, go
was
ahead.
just going to say, I'll just add on to that, that in my experience when I was an administrator, if you guys are scared about a disease, a virus, anything that you're not as familiar with, reach out to them. That's what they want to hear. And some of those you're
Mhm.
required to report too. So you're going to have that in your licensing, some of those communicable diseases you're required to report to the DOH. But they're great. They're not scary. They're going to help you draft even communication out to your families so that they know what to look for or maybe why you're excluding on certain symptoms. So they're definitely a resource that I don't think as many early childhood providers and facilities maybe know about or feel comfortable using. So do it.
Yeah, I agree. So definitely use them. Okay, so measles. Guess what? They're back. There was just an article on NPR that stated that the U.S. is likely going to lose our measles-free status because we've had so many huge outbreaks. So the measles vaccine was developed in 1963, and I love this chart because you don't have to be an epidemiologist or a statistician to look at it and be like, oh, so vaccines work. They do a really great job. So this is measles cases in the United States. You can see that there was a pretty big, pretty big outbreaks in the 90s. But once public health policy got up to speed and we got, vaccine programs in and that type of thing, we were virtually zero for years and years and years until kind of the anti-vax movement started creeping up. And this goes to show you how important this is because we still have a lot of immigrants and people that are coming in that don't have access to these vaccines. And so they themselves may have been positive or had the disease, but it had nowhere to go. It couldn't spread because everybody was vaccinated. And so it stopped its track. This is a great example of like herd immunity or just like how vaccines work at zero. And then now in 2026, you'll see obviously a huge jump. So next slide, please. So the Department of Health does track all of these communicable diseases, and we actually have a measles dashboard that will show you how many cases we've had. So I took this screenshot. This was on January 21st. So on January 21st was this the last update that it had. And as of that point, there was 16 total cases here in South Dakota. And again, you'll see down in the bottom line, we have kind of the same, we mimic a lot of like what was happening in the United States. A couple of cases like in the 90s, but it largely dropped off in the early 2000s. And then 2025, we had 16 cases. These are the cases that were only ill enough to actually go into clinic and have a physician test them for it. We know of specifically that, like, at least one of the cases, there was at least three or four other contacts that were also very ill, but they were adults and they had a good enough immune system where they didn't have to, they didn't get so ill that they had to come into the clinic to seek care. There was one hospitalization, thankfully no deaths, but all 16 of those were unvaccinated, which I'll kind of get into. I mean, the reason was like if the measles is so highly infectious that it will find an unvaccinated population and spread to it, essentially. So what does that look like for you guys? Next slide, please. Well, you might actually see it, and it might actually be in your classroom, especially in some of our areas where we maybe have some more like Mennonites or people that don't have vaccination, kind of rules or policies like the majority of us do. Um, where we have those unvaccinated pockets of people in South Dakota is where you're going to see some of these things. It starts with a fever, cough, runny nose, and red watery eyes. I mean, that's it. You're like, all my kids have that right now. Like, how do I know that this is measles or not type of thing? Well, they will likely be unvaccinated, truthfully. So it's really good to know what the vaccination status is of your kids. So you're like, oh, maybe it's just a cold with like some conjunctivitis or whatever. The fever usually starts at 101, but it can get really high up to 105. High fevers in kids is bad, can cause seizures. We don't like to see high fevers in kids. Yes, they're like protective in the sense that the immune system is working, et cetera, et cetera. But the amount of kids that came into the pediatric ICU for febrile seizures is staggering. I mean, there's a reason why the body can't tolerate it at a certain point. So, and it's damaging to your brain cells. So, a rash can show up a few days later. It usually starts in the face and then spreads down to the body and out to the arms and legs. So here's the kicker. You're most contagious 4 days prior to that rash onset and then 4 days after that rash appears. We're talking 8 to 10 days, depending on how long they have that rash, where they are highly infectious. 90% of non-immune people, so people who have not had that vaccination, will develop measles if they become in close contact. And the measles virus can live up for 2 hours in a space. I can cough in a room, leave, and those particles will still be lingering 2 hours later. Disgusting. But that's what makes it such an effective virus, is because it can do that. So a lot of long-term damage that can be done with kids. And what's really sad is that obviously children that are under 1 year of age can't get the measles vaccine. The kids are born with a blank slate. They have no immune system. Their immune system is getting taught by environmental exposures, by exposures to illnesses, et cetera, and to vaccines. That's why we have vaccines. We're teaching their immune system, hey, this is super bad. Like, know how to recognize it in the future, that type of thing. Just to, for people who are like, I'm really nervous about the vaccine, that type of thing. One measles vaccine has about 1,000 copies of the weakened measles virus in it. Your cell phone, for example, has about 17,000 different antigens living on its surface. So literally, your cell phone is dirtier and more disgusting. It has a lot more different bacteria and viruses on there than the actual measles vaccine does. So, next slide, please. Prevention, most effective prevention is vaccination, the MMR. One dose is 93% effective, but again, you can't give that until they're 1. 2 doses are 97% effective. We give that around 4 to 6 years, but the immunity is lifelong, which is super great. The other thing that prevention-wise, you just gotta quarantine them. You can't keep them. They can't be in your classroom because they'll just continue to spread it, especially if you have non-immune children. So. This is in infant rooms is super important. This is a picture of me giving. I was one of the first people, because I worked in the ICU. I was one of the first people to get the COVID vaccine. So, and I'm doing fine. Next slide, please. Pertussis is another big one, whooping cough. So this is a dashboard that kind of tracks all the infectious diseases, and this is a summary of 2025. And you can see that pertussis, last year, 2025, there was 203 cases in South Dakota at a rate of about 22%, and that percentage changes up 497%. Again, pertussis, whooping cough, is a vaccine preventable disease. What does it look like? Has anybody seen a kid with pertussis? Okay, next slide, please. We are gonna play what it sounds like. I'll have you play that one, Rose.
Oh. So as you can see that obviously it starts out as like a pretty common cold, but unlike a cold, it just lasts and lingers for a really long period of time. It is a bacteria, so you can, if you treat it early on enough with antibiotics, you can kind of lessen the effects of it. Super serious under children of a year old, because their airways are so tiny. They're about their pinky or their pinky finger, and they kind of funnel, so that like kind of whooping cough is them trying to get breath in, and it's so stridorous, it's so thin with all the inflammation and everything going on that's the sound you're hearing. So you might hear like stridor in croup and RSV as well. Those are also kind of difficult ones, and you want to take them seriously. So when you start hearing that sound, their airway is pretty close. I'll never forget, I was working in the ICU, the peds ICU, and I had a child who was in for like a type of meningitis. It was a vaccine preventable meningitis. And I was a young nurse, and my jaw just dropped because the mother basically told me, she's like, I just don't want to give my kid vaccines. Like, there's so many chemicals in them. And
her child was literally had a breathing tube. She was on a ventilator. We had a central line going into her veins in order to drip life-saving drugs and like blood pressure medications to keep this child's blood pressure up, as well as sedation medications to keep this child comfortable while they're on the ventilator. And I just remember being like kind of in awe that the misinformation and kind of the disconnect was still there. I mean, she clearly loved her child and there was like, she wanted the best for her. But I mean, this kid was super, super sick and it was preventable. Vaccines obviously are really effective on this, and that's why we give vaccines to pregnant women, is because, of course, our children are born with blank slate immune systems, but you can actually pass immunity to them through pregnancy if you give a pregnant mother vaccine. So that's why we suggest this, because they're not old enough when they're born to be able to get the vaccines, but we can give them a little bit of protection through antibodies with vaccines. And then to some extent, there's like, breastfeeding and stuff like that. So next slide, please. And so I'm just going to end with this. If it's wet and comes from somebody's body, it is likely infectious. So you're just going to treat it and assume like everything is infectious. You're going to wear your gloves. You're going to disinfect and make sure you have the policies and procedures in place to make sure that that's good. And then what I like to say is be thankful that you have a fully functioning immune system, because it is doing a lot of behind the scenes work that you're not aware of. And if you watch some of these, films on epidemiology and things like that, you're going to be kind of like, oh yeah, the world is disgusting, but thankfully I have an immune system. So with that, I will pass it on to Krista. And obviously I'll be here for any other questions you guys might have.
Thank you, Leah. Yeah, we're gonna hop over to Krista for the next couple of points.
All right. That was a lot of really good information, and some of the things that I might have known. It's just that reminder of like, oh my gosh, like my phone. I'm looking at my phone and I'm like, don't touch it. So yes, okay, I will be talking about indoor playground and outdoor safety. So following the CKCs, which is our ECE systems, core knowledge and competencies, health and safety and nutrition, educators should have knowledge of health and safety standards, practices, and licensing regulations to reduce hazards in your program's indoor and outdoor environments. If you are not aware of what the CKCs are, feel free to reach out to your ECE regional office and they can get you a copy. It's a really good resource to have just to keep in touch with what you should be looking at, and things like that. So, all right, Rose, go ahead. Okay, a little bit about indoor safety. Some things to keep in mind. So keep the area where care is provided clean. So I'll go through some examples. Floors vacuumed and mopped daily. Toys cleaned daily. So not, every other day, not leave them out for a week and then clean them on Fridays. No, make sure the ones that are being touched and played with or put in their mouth, they are cleaned daily. And that way you can kind of change which toys. So you could do every other day toys. So these toys and then clean them, then do these toys. So just kind of switch them out. Um, Also walls or areas where kids are constantly touching, make sure you're wiping those surfaces down. Um, Furniture, cleaning them daily. Maybe you're vacuuming, if you're in home daycare, you got couches or chairs that are, soft cushions, make sure you're sanitizing those, vacuuming regularly. Watch for dangling cords, sharp objects or corners, wrinkled rugs, torn up rugs, just any safety hazard that kids might come into contact with, or even staff. I mean, staff could trip and get hurt themselves. So make sure chemicals and medications are stored properly and inaccessible for children. Following safe sleep procedures by placing infants on their backs to sleep. Watch for choking. If an item can fit through a toilet paper roll, then it is too small for children under the age of 3. Know the allergies of children. Take steps to prevent situations that could be harmful and can take appropriate action if needed. Learn and follow licensing, safety regulations, especially for registered programs, and any additional program safety policies and procedures. Okay, Rose? All right, a little bit about outdoors. So this is a little statistic. So statistic, over 200,000 playground equipment related injuries occur annually that require emergency room treatment. Um, you never know what could be left outside, especially so if you're going to be outside, it's a good idea to have somebody at least go scan the area before you bring kids outside. You never know if somebody could walk by and throw something over the fence at night. It could be cigarette butts, it could be um, needles, it could be anything that they're just discarding. And if you're not going to scope it out beforehand, a kid could get in contact with that. Also, if you have sandboxes, make sure they have a cover, or you might have animals that get inside of there and they might be doing their thing, and then you got kids playing in there and just gonna stop there. So make sure you guys are scoping your area before your kids come into contact with it. And then also you're checking over your equipment. Oh,
Sorry.
tap that fast, Rose.
Yeah.
And just make sure you're checking your equipment too. So go ahead. Now you can go on to the next one. Here's a little percentage types of injuries too. 79% are falls, 68% to a surface, 10% to part of the equipment, 1% could just be unknown, 11% impact, 8% with stationary equipment, 3% with moving equipment, 10% miscellaneous, usually crush points and sharp edges. They're running into things. Maybe there's something that is unsecured that they grabbed onto and they hurt their hand, or they stood up really fast, maybe in a slide, and they hit their head on a sharp object. So just make sure that you are, again, scoping and you're looking for hazards that kids could come into contact with. Okay, Rose. All right. Here's just a few key points. Fall absorbing surface of your equipment. So that's your base. Do you have and then licensing, if you look onto it, especially onto the onto our website, or onto the website I cannot talk. DSS website will have a layout of what could be appropriate for a surface. So just make sure you're looking at that. Stable, well-maintained structures, no broken equipment, exposed bolts, sharp edges, again, active supervision. So licensing lays out specifics for environment, health, and safety. Each registered program is inspected regularly and follows certain guidelines. So when licensing does come out to your program, they have guidelines that they're looking at, and they are specifically looking for your surface, your playground equipment, the space. They're very specific about that. Do you have appropriate challenges for different ages on your equipment too? Age appropriate equipment. So toddlers shouldn't be on school age equipment, unsupervised. And then school agers should not be on toddler equipment. So like those plastic slides, those small little plastic play equipment, that is not appropriate for older children. Especially if have mixed stages and whatnot. I understand, maybe you may not have the funds or the space for it, but it's better to just let them go play in an open space, the school agers, as opposed to possibly jumping on the toddler equipment and breaking it, and therefore causing, a crack in there that a toddler could put their hand in and get hurt, or vice versa. So those are just things to kind of keep in mind. Feel free to reach out to your ECE regional office, and one of us can come out and help look at your environment just to see if it's okay, if there needs to be changes, things that you can modify for different ages. We can help you do that as a verse to having something happen. Okay, next slide. This is just a little acronym you can go by. So SAFE. Are you doing active supervision? Do you have age appropriate design? What does your fall surfacing look like? Do you have a surface for them to land on that's soft enough to not get hurt? And then is your equipment continually maintained? So just something to look at. All right, supervision and ratio. Children are safest when adults are actively watching. So not just watching, it's are you actively watching? Are you counting? Are you positioning yourself well around the program or space or wherever the children might be. So we'll get into it. All right, knowing how many children are present at all times, being able to see and hear all the children, and scanning during transition. So, are you counting faces, not just heads? Because you might have a set of kids and you're counting them and you think you have everybody, but oh, we got little Johnny here that's not supposed to be in my care. So make sure you're counting faces. It's just a little bit more accurate instead of just heads thinking that you have your number. And then are you communicating with other staff members about your numbers? So during transitions, maybe you have teachers that are coming to give breaks or vice versa. Are you telling them how many kids you have? Constantly counting, constantly telling them how many you have, and then they're communicating as they transition as well. Counting multiple times a day. So not just in the morning when they come in, not just when you're outside, all the time. Are you counting? Are you making sure you know how many kids you have? The number can change due to things that go on during the day. So maybe you're the morning teacher and then you have kids that get signed out. So then you think you still have that number and then you communicate that to the staff that come in later and then they think that that's how many kids you have. So then your number is off. And so it's just that communication, best practice. You're being safe, count and communicate. Being present when you're outside on the playground. So being present doesn't just mean your body is outside with the kids. Is your cell phone in your pocket? Are you actively looking around? Do you know how many kids you have? Are you walking around? Things like that. Also inside in the play area, when you go on a field trip, when you're on the bus or your vans, you're looking around, you're not just hanging out. Transition, when you're inside, all of those things. Kids look for opportunities when teachers aren't paying attention to them. They know they're going to look at you if you're not looking at them, and they're going to say, oh, they're not paying attention. I'm going to go punch this child in the face. I'm going to go jump off this playground equipment. I'm going to go challenge myself because my teachers aren't watching. So they're going to do that. They're going to look for those opportunities. And then we're going to look at three main types of supervision next. Okay, so there's all kinds of ways to supervise, to look, to pay attention to your kids, but if you guys just keep these in mind, these are the three main types. So there's monitoring, focused supervision, and concentrated supervision. So monitoring is when staff are centrally positioned within visual and hearing range of activities. So you're on the playground, you're in the middle, you can see everything. There's no blind spots. Kids can't go hide from you. You can scan and look. Staff's attention is focused on the overall safety and supervision of the children. Standing in the activity area, watching kids play in different centers. So if you're inside, can you see? Are there any places where they can hide? Just position yourself in a way that you can see everything. Scanning involves regularly glancing around the whole area to see what's happening. Again, you know how many kids that you have. You can see them, what they're doing. Listening, you're listening to what's happening. For example, you hear a bang and then you're able to kind of look around and see what that was. If you're with older kids or even younger kids now, what kind of language, what are they talking about? Are they being inappropriate? Are they, what are they doing? Maybe you hear a bunch of laughter over in the corner somewhere. Are they ganging up on a kid? Are they bullying? You don't know what could be happening. So just actively listening and paying attention. Always position your body so that you can observe the maximum area possible. And then never sit or stand with your back to the kids. I mean, if you're scanning, you're looking around, you may not see them, but position yourself kind of where you can see out and see everybody. And then focused is when staff are within close and visual hearing ranges of 2 or 3 different activities at a time. So if they're not just kind of in one area, you're in where maybe most of the kids are. And then you might have staff over where a few of the other kids are. So instead of hanging out where maybe 1 or 2 of the kids are and seeing all the other kids over there, position yourself where the majority of the kids are, and then you can still kind of see and hear what's going on with everybody else. While you're near those two or three activities, are you still scanning the area? Do you know what's going on with everybody else? Continue to listen for sounds that indicate what's happening and then observe the movement. And then lastly, concentrated is when staff are directly involved in the activity due to the complexity of it. Um, I guess for an example, I work with school agers. So if you're working with a group of older kids or school agers, maybe you're doing a candle making activity with them. Um, you're not just going to let them be by themselves with all of these tools or equipment. You're going to be concentrated. It's like a teacher led activity. That is where you are. You're concentrating on that. But if you are leading that activity and you have other kids playing maybe in this area over here, you're still able to hear and see them. You're not going to turn your backs to them, but you're going to lead this activity and kind of scan and look around and then lead the activity. So you're still able to do it. Um, and then be alert and listen at all times. And then if something does happen over in this area with these kids, do not just leave your concentrated activity. Maybe pause it or have another teacher come over to take your position and then you go over. But that may not be something that you just leave and say, okay, you're fine, and then go over there. So these are just to touch on the different ways to supervise.
And I want to add on to what Krista said here, because we see too often, and a lot of times on playground, is that we're not as aware and we're not moving our bodies around, right? Like maybe we have been in a room all morning by ourselves and we haven't seen another adult. And so we want to go have a conversation with a co-teacher or catch up on what happened during the morning. But when you are not doing these steps, not the scanning, the listening, and positioning, we miss out on some of those things. We are not in closer proximity to those children who like to take the risks, right? Because when we provide closer proximity, they know that we are there close by, and we can also help intervene if danger happens. Sometimes the most powerful lessons are those real life stories. And when I first started out in admin in Sioux Falls, there was an unfortunate event at an early childhood facility where a young child was strangled with a jump rope. They had been playing on a playground structure and went down the slide and it got intertwined. And the teachers were not doing these steps that Krista defined. They were not moving around. They were out there. They were the body, as she said. And that child did pass away. And so that immediately made me think, well, jump ropes are not going to be out on the playground. Number one, early childhood, there's not a lot of little kids that know how to use it. But then you get to go back and look at your policies and procedures, which Krista is going to touch on next. So just make sure that you guys are moving around, that you're engaged and involved with the children, and that's going to be the biggest preventative measure.
And with that, Rose, it's good that you brought that up because I went to a Kid Stop program not too long ago, and the school had let them play with jump ropes on the playground. So they were swinging with the jump ropes, and they were playing like the lasso games and things like that. And I was like, absolutely not. We are not doing this. So unfortunately, I wish, maybe the schools have different policies, but you'd think that they would take extra precaution with that. But we can only hope. So, on to policies, procedures, staff training. Even the best policies are useless if staff don't understand or follow them. So, go ahead. Okay, clear written health and safety procedures, regular staff training and refreshers, consistent enforcement by leadership. So procedures must clearly be written to lay out every procedure in case of emergencies, staff changes, family changes, program changes, state changes. And this is just an in-house document. It's not to be shared, unless you have a parent handbook that you'd like to communicate with, but it's more for directors, their staff. You guys have that policy that you follow. You're regularly maybe quizzing new staff on it just to see if they're well aware, so that you don't run into any hazards or any unsafe actions. So just constantly be going over it. Maybe every time you guys have a staff meeting, you're just going over, okay, do you guys understand? Any questions on our policies, on our procedures? That way everybody is on the same level. You guys are rolling the same wheel. Nobody's going all over the place. So
I would also kind of interject into one thing that you can do. I mean, policies and procedures can get real dry, but take a, a a game from the healthcare world, but use case studies. So use actual events that have happened. I mean, policies typically exist because an unfortunate event happened. So as you're doing this, don't just like drill in the dry stuff, but also think of how can you get these people to critically think. So do a case study. This is happening on the playground. What are you going to do? According to our policy, what would you do? That type of thing. So just kind of a little tidbit to interject there. Sorry, Krista.
No, I love that. I think, and that's a good fun way to do that. Yeah, make it relevant. Don't just say, here's step 1 through 5, blah, 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 every single time. Yes, make it relevant. And then it's also challenging the kids sometimes, asking them, okay, what are we, ask them the or the rules on the playground or things like that to make sure that they're aware of their safety. And I mean, I'm sure you guys in childhood education, now what is our job? And the kids are to keep us safe. So it's like that, continuing doing that. Staff should be trained regularly since there are always ongoing changes in the childcare world. Staff who stay up to date and in the know will create a quality childcare program. And licensing only requires 10 hours of training per year, but why stop there? Why just get your 10 hours? Why not keep it ongoing? So there's always so many different ways to learn. We all need reminders. I'm constantly learning new things all the time. I love to research and read, and I love to be in the know because kids are growing. So as they're growing, as they are continuing to get older and to move on to the next grade level, that's what we should be doing too. We should be raising the bar for ourselves, for our program, and just constantly learning new things. Um, Also, leadership must hold everyone accountable and up to program standards to ensure quality and safety for all. Health and safety must be part of daily practice and not just a binder on the shelf. So make it ongoing. Hey,
To
Rose?
add on to that, make it ongoing. What Leah said, and is something that I used to do at staff meetings, is to take one type of policy or one type of situation and insert children that our facility teachers knew about into that so that it made it more real. You all know a child that's an eloper, right? So asking them, all right, we're 5 o'clock, families are coming and going, you're in there by yourself, there's 9 kids and child X elopes out the door. What are you going to do? What's your next step? So putting it in that way, because this could happen to them, makes them pause and reflect and speak to it on a level that now it makes sense why those policies are there, right?
Yep, definitely. Okay, I just have couple more slides. Now we'll get into a little bit of physical health. So along with wellness, preventing those diseases, those illnesses, we also have to think, okay, physical health. That's going to keep these kids, going to give them benefits along with us too. So along with regular health and safety procedures, we also need to consider some other factors which will contribute to overall health. So just a few tidbits of information. Birth to 12 months, you can do tummy time. So that can be at least 30 minutes of supervised tummy time, should be spread throughout the day when awake. So it's not just throwing a baby on the ground and saying, okay, tummy time for 30 minutes. No, it's just getting it into that routine of making sure they have at least 30 minutes of that movie. Infants should not be sedentary for more than 15 to 60 minutes at a time, except when they're sleeping. So these are just best practices to follow. By 12 months, infants should be learning to hold their head up, sit without support, roll, crawl, and pull their head up to a stand. So tummy time helps with that. I shouldn't have said throw on the floor. That was not the best wording. I think you guys understand what I mean. Do not set the baby. There we go. That was a little better. It's getting late, guys. Okay. Toddlers 12 to 36 months, at least 180 minutes, which is 3 hours of physical activity per day. So that's not just ongoing, but that's how much they should be having per day. So spread it out, but they need that physical activity, including light, moderate, and energetic play. At least 30 minutes daily of structured, which is adult led, so play a game with them. That could be anything. Add it into your curriculum, your circle time, get them moving, do it with them. This could be your opportunity to get moving with your children too. So that helps your overall health. So if you are constantly getting sick, maybe you need to get moving more. Maybe you need to get that physical activity. At least 30 minutes to several hours a day of unstructured, which is that free play too, but that could still be controlled. Should not be sedentary for more than 60 minutes at a time, except when sleeping. So if they have that need to move, that should be your key. Okay, let's move. That's what your body needs. Preschoolers, 3 to 5 years, at least 180 minutes, which is 3 hours per day, a variety of physical activities. This should include at least 60 minutes of moderate to vigorous physical activity. Activity should focus on balance, coordination, and large muscles. So instead of just letting them run free all the time, like have a mission with what you want them to do, okay? If you want to help them balance, if you want to help them skip, jump, all these things, then provide multiple opportunities for them to do that. You're teaching them skills. They will learn it by play, but you're helping them. And then screen time should be limited or best practice not used at all. School age, 5+ years, at least 60 minutes or more of moderate to vigorous physical activity daily, including aerobic, muscle strengthening, and bone strengthening activities, limiting that screen time. On the screen, these are all the benefits of physical activity. Okay, my almost last slide. A little bit on behavioral and emotional safety too, so that we can give you a full, well-rounded health and safety presentation. Okay, children who may have experienced ACEs are at a higher risk for developing chronic physical diseases, which could be cancer, heart disease, diabetes, mental health issues, depression, anxiety, PTSD, suicidal thoughts, and substance misuse. Provide multiple ways to curb the risk factors when they get older. So you can be that protective factor for these kids if you have clear behavior expectations, positive behavior strategies, de-escalation techniques, so those calm spaces in your classroom, anti-bullying, trauma-informed. So again, with that ongoing training, if you're constantly seeing, certain behavioral things, we always get requests for behavior training. Maybe let's go into another area, that trauma informed and culturally responsive practice. And then also reporting procedures for suspected abuse and neglect. So making sure you guys know all the policies, everything, and that you feel comfortable doing that. And then this is just a good quote to leave you with. There's usually an inside story to every outside behavior. Though we may not be able to know what that inside story is, there's generally some inner reason for what children do. So behavior could also stem back to them not feeling good. So it's not just that they, oh, this kid doesn't like to listen, or he just started to do this. Well, maybe they have an ear infection and they don't know how to tell you. So they're going to be running around, hitting their head, doing something, and it's true. So just something to keep in mind. Okay, that's it.
I love that last quote because I think it encompasses not only what Leah started us off with, but then where you went to, Krista. So that was really great.
Circle.
Yes, yes, whole child. So then now next step. So you guys are primed, you're interested, right, of all that great information. Here are some great resources to further dive into. All of those hyperlinks in the document that I emailed you from Leah as well are here too, but these are just 3 logos that we work with a lot. So the NAAA, I'll let Krista talk about that one first.
The NAA, so the National After School Association, is kind of like the after school variation of the NAEYC, however you say that.
Yes.
You can tell I'm more versed in the other, but that is just a good resource. It still encompasses, those older preschool ages too, but that is a great website to go to as they're transitioning from preschool to school age. There's huge differences, and that is kind of what we go by is just the National After School Association. So good resource for school age and everything that's in that.
Thank you. And then we talked a lot about the Department of Health. Was there anything else on that that you wanted to add, Leah?
No, obviously I don't represent them because I'm no longer working with them at all. But just know that they are there and they're not just regulatory. So don't be scared to reach out to them. I would also say too, just Googling things and the CDC still does have a lot of information on there that is still very pertinent. And then I also troll a lot of other public health departments, so other state health departments as well. Sometimes they have some good stuff on there, so always kind of keep an eye, or like you can add that into your search if you're looking for any other policies or regulations. Just kind of a little hack there if you need some more ideas.
Love it. Thank you. And then the last logo there is our enrichment system. So we are one of five. ECC is the South Dakota Early Childhood Enrichment. We're the western side. And we have a resource hub. If you guys are not signed up for it, it is like a one-stop shop for anything that you might need in early childhood. And there's a whole health and safety section. So if you guys are looking for policy examples, clear explanations, maybe some lessons on hand washing that is appropriate for toddlers or preschool. So all sorts of things can be found there. Then the last one here, professional growth. So as always, if you want to continue in this field and be a professional, what are some things that you can do? Over here on the left is a brand new credential that Krista's been working really hard on. So if you're in that after school arena, you can now earn a credential very similar to the CDA. So this is a really great one. And if you're interested, Krista, you want to drop your email in the chat and then they can reach out. And so yeah, this will be a really great thing for you to show to your families, your fellow teachers that you are a professional. That middle one is our local chapter for NACI, but this is the SEDACI. And this is just where you can have a collective of other like-minded early childhood teachers. You get a lot of free resources. You get discounts to our annual conference. So a lot of really great things come from that. And then your child development associate. If you don't have it, it is a program that is the most nationally recognized early childhood credential. And it does articulate into free college credit. So if you have your CDA and you want to go on to get an associate's or a bachelor's, Black Hills State and Ogallala Lakota College here in Western South Dakota both honor it, and you can get up to 12 college credits by articulating that. So, all right. We've got a little bit of time. Let's see, we've got 8 minutes. So we are going to do the pre-submitted questions. Turn it back over to the experts. How do we balance health and safety requirements and developmentally appropriate relationship-based practice, especially when children need movement, risk-taking, and autonomy to learn?
I can start with that one.
Okay.
So kind of from just my going back to my presentation a little bit, was focusing especially on that breaking that chain of infection and making sure that they're physically being healthy. Obviously, you're just going to have the appropriate environments, kind of alluding to what Krista talked about as well. The appropriate environment, let them have toys that can go into their mouth, and obviously that's a gross motor skill that infants and toddlers are going to need to do. Or if they have that urge to bite on things, just make sure it's a safe one. Make sure it's not cracked, there's no tape on it, and that you have a proper disinfection tool to do it as well. So I think that's what you guys are doing all day long, right? You're balancing health and safety with making sure that these kids are being challenged and that they have a boundary that they can push up against, so that they can actually feel safe and continue to learn. So
Awesome.
And I guess I'll just add, make it a part of your routine, incorporate, different things into your lesson plan. It doesn't have to be some separate thing, get a little creative. How can you incorporate different songs that talk about hand washing? Instead of singing, regular circle time songs, sing the hand washing song, sing the toothbrushing song, get kids just into that healthy minded routine. And then also to get them physically active. I'm just more of an ideas person, but laminate your hand washing pictures. Again, I think Rose said that we have some of those resources. So get some of those the steps of the hand washing and turn it into a hopscotch game. You're getting them physically active while you're training them to be healthy, and they're memorizing the steps to the hand washing. So you just covered three different things. So yeah.
Awesome. And then the second one, what does health and safety look like beyond policies and checklists, especially for children's emotional well-being and sense of security?
So I don't know if any of you are familiar with Atul Gawande. He's a physician that has written a couple different books that are really great. If you're looking for a good read, any like nonfiction, I recommend that author. But he has a book called A Checklist Manifesto, and he states essentially that a checklist cannot fly a plane. Instead, it provides reminders of only like the most critical and important steps, the ones that even if you're a really highly skilled professional using them could potentially miss in a high stress situation. So good checklists are above all very practical. And so that's what I would say for this question is that like I know checklists and policies can be really like boring and daunting and all that other stuff, but they are really important, even for the most like skilled people that are doing high risk things. Kids need when you have a checklist of like a policy of things that are in place, you're creating these really safe boundaries for kids. Kids are constantly kind of trying to find that outer edge of a boundary, not only for them to kind of grow and learn, but they know that those boundaries are like, I think ultimately that piece that just keeps them a little bit safe, right? So it's weird to say this, but I do think that there's a very big sense of security in routine and in boundaries that exist when you have those in place. But you, as the adult, as the provider, need to have your little checklist manifesto, your little policies and procedures. You have to have them in place for those kids to be able to feel that. So there's kind of a good tension in that, I think.
And I'll just quickly add, just practice those health and safety routines yourself. Be that model for the kids. That's kind of their sense of security to say, oh, okay, my teachers are doing it too. And then whatever you're learning, pass it on to the families and get everybody incorporated. And then the kids feel that sense of security and they feel safe. They feel taken care of. Their needs are being met. They feel seen. So just kind of that relationship, that whole child relationship, families, providers, you guys are modeling. So that's just what I would add.
No, I think you guys did a great job of answering that. So thank you. Okay, so we are wrapping up. Of all the forms of inequality, injustice in health is the most shocking and inhumane. And that is MLK Jr. And I just thought that was fitting because we just celebrated him. So I want to thank you guys all for spending the evening with us, talking about how critical this topic is, health and safety. Again, it's not just the rules, inspections, compliance. It's about, like these two ladies just said, creating these systems and relationships with the families that we partner with. And that is going to create where children feel protected, supported, and they're going to do so in a healthy environment. You've reflected on what it means to be healthy and provide safety through relational practices and how you can recognize physical safety, emotional well-being, and just that whole child, like these ladies summarize really well. So as you go back to your programs, I hope you guys can take back some reminders, some practices, maybe some great resources from that document link. If there are any wrap-up questions, I saw none in the chat. Oh, but there's one. Where's that Krista's email? Oh, yep, that's your
Yeah,
email.
yeah.
So I didn't see any questions pop through. If you have them, please feel free to drop them there. I am gonna keep moving along. This is, let's see if the link will work. Our website where you can enroll in any of our trainings. So here is our training calendar for February. Obviously, we offer CPR. Krista and I are instructors. Krista more frequent than myself, but there's a bunch of other ones that are really great in this topic. Bodies in motion, health and safety every day. So if you're wanting to dive a little bit deeper, there's some ongoing trainings this month. And get back here. Now it is time for our evaluation. This is how you get training credit for tonight. So you do need to complete this. I'm going to drop the QR code, or I'm going to drop the link in the chat. You can scan the QR code as well. While you guys are filling out the evaluation, I will be playing a trailer to, it's called The Raising of America, and it talks about that whole child healthy view, how we can support that. Before I play that, though, I will turn it over to the experts to have some closing remarks. Okay. Let's start with Krista.
Oh, I'm already on.
Okay.
Just want to say thank you for letting me share. Feel free, I guess, just to reach out, especially if you're in Region 1. Feel free anytime to reach out if you would like us to come to scope your environment, your indoor-outdoor environment. We can check to make sure you guys are meeting the standards that licensing looks at. We can do a little TA with you if you're unsure of how to, incorporate some of the things that we said with your routines. We can get you in touch with resources like Leah was saying. We can help you get familiar with all those tools she was talking about. So just please feel free to reach out. Don't hesitate to ask for help, but don't be scared of, all the germs or anything like that. Get the kids moving and just be that model for them to live healthier, and you guys as well. So that's all.
Thank you, Krista. All right, Leah.
Disinfect your cell phone. Be thankful for your immune system. And I just hope overall that you kind of got a slightly different perspective. You might look at the world a little bit different from like a virus's point of view now from after that. But thank you guys for having me. I appreciate it.
We are so appreciative of your expertise and willingness to support this event and support all of you early childhood educators. So us at ECC, we value you and we see your hard work every day. So we really appreciate it. All right, well, that is it. I'm going to play the video, but when you guys are done with the evaluation, you are free to go.
Let's see that again. He opens the Gemini app, takes a picture of his car.
Get through the ads.
In the richest nation in the world, our children's well-being, measured across multiple dimensions, ranks 19th out of 20 rich nations. Why that is and what we can do about it matters. To this child, to all of our children, and to the future of our society.
We talk a good game in this country about being family friendly, but in providing for the economic and social needs of families, we are woefully behind other countries.
Want to show Daddy a book?
In today's day, we all gotta work. And I can remember back in like my grandfather's days, the man work, the woman stay home and take care of the house and, family, thing like that. In today's day, it surely can't happen. Everybody gotta go out and work and, bring it in.
Very good. Yeah, you're going to show Daddy
Yeah,
a
he
book?
works a split
Very
shift.
good.
So like 2 in the afternoon to 1, 2 in the morning.
Yeah.
I'm on nights this week. And so the next week though I'll be on days.
Americans now work more hours than every other rich nation, yet the middle class is shrinking. Social mobility is less than it was 50 years ago. And most damning, 1 in 4 of our children is born into poverty.
David, tomorrow's a really hectic day. I have a training. I have to be there at 9 o'clock.
70% of our children are growing up in families headed by working parents.
I bring work home with me, and it's not required. It's just what I do so that I don't feel as overwhelmed.
Things just barely work out. Like feeling security. I don't really know what that feels like, to feel like, all right, we're good.
That way, no, you silly girl.
I wake up in the morning and I'm on.
It's like, where's my other child?
And then I go to work and I'm on.
You have a good day, little one.
And then I come home and then I'm on until the kids go to sleep.
There's 4 different places that everyone needs to be in.
It's too much. I can't do it.
Our policies actually actively discourage parents from being able to take care of those kids well in their prenatal months, in their early years, and getting them ready for school.
Among the world's richest nations, the United States is the only country that fails to provide guaranteed paid maternal leave on the birth of a child.
It took 9 years to get unpaid leave. That's disgusting.
40% of all American mothers are working within 3 months of their baby's birth. Some because they want to, most because they have to.
Our childcare expenses, now that we have a second child, it's way more than we spend on our mortgage.
Among rich nations, our childcare ranks 16th in affordability, 22nd in quality.
I picked him up one day and I went to change him and his bum was bleeding. So we left there right at that point.
We rank 31st in availability of childcare.
So this is our wait list, and this is the wait list just for infants and toddlers.
If I'm not there, I'm entrusting someone else to keep her safe, to teach her, to help her grow in all areas, developmentally, spiritually, because we can't do it alone, you know.
Once you imagine that every family stands on its own, you're really making it impossible to create a national vision of everyone doing well together.
A lot of us buy into this idea that a parent is the one responsible for their child's development and their outcomes.
Go ahead, Lily. What are you thankful for?
My mommy and my daddy.
But let's just step back for a moment and just look at what exactly the reality is for a child.
Oh.
You have a child who's an individual with their biology and their genetics and their personality characteristics. And they're nested in their family, their peers, their close social relationships. But that is nested within another level, which is your school, your community institutions, your neighborhood. And that level is nested within our culture, our laws, our policies, our social structures, our systems. As a society, where do we see the role of our policies? Isn't part of that role to help children to grow and develop?
The business community of the United States has always shaped big policy priorities. In the country, the big political priorities of the